Hello and welcome. Today, we're diving into a complex and often misunderstood neurological condition, autoimmune encephalitis. This is a disease where the body's own immune system mistakenly attacks the brain, leading to a range of neurological and psychiatric symptoms. It's a challenging diagnosis, and early recognition is crucial for effective treatment. So, what causes autoimmune encephalitis? The precise trigger isn't always clear, but the underlying problem is an autoimmune response. This means the immune system, which is normally designed to protect us from infection, starts attacking healthy brain cells. This misdirection often involves the production of autoantibodies, which are antibodies that target specific proteins in the brain. Sometimes, these autoantibodies develop after an infection, such as herpes simplex encephalitis or certain viral infections, or they can be associated with an underlying cancer, particularly teratomas of the ovary. Let's explore the pathophysiology. These autoantibodies target specific proteins located on the surface of neurons or other brain cells. These proteins often play crucial roles in neurotransmission, synaptic plasticity, and neuronal excitability. When autoantibodies bind to these proteins, they can disrupt normal brain function in a few ways. They might block the protein's function directly, causing a functional deficit. Alternatively, the binding antibodies can trigger internalization of the protein, removing it from the cell surface. Finally, the autoimmune attack can lead to inflammation and damage of brain tissue, further contributing to the neurological dysfunction. The specific symptoms experienced depend heavily on which brain proteins are targeted by the autoantibodies. Understanding how common autoimmune encephalitis is helps put things into perspective. While considered rare, its exact prevalence is difficult to determine. This is because it's often misdiagnosed or underdiagnosed. Studies suggest that autoimmune encephalitis may account for a significant proportion of encephalitis cases overall, potentially even more than some previously thought. It can affect people of all ages, from children to older adults. Some forms are more common in certain age groups or genders. For example, anti-MMDA receptor encephalitis is more frequently seen in young women. The symptoms of autoimmune encephalitis can be quite varied, making diagnosis challenging. They often evolve rapidly, and can include psychiatric symptoms like psychosis, paranoia, or mood changes. Cognitive problems, such as memory loss, confusion, and difficulty with attention are common. Seizures are also frequently seen. Movement disorders like tremors, dystonia, or abnormal gait can occur. Other neurological signs include speech difficulties, visual disturbances, sleep disturbances, and autonomic dysfunction, which can affect heart rate, blood pressure, and breathing. Because of the diverse presentation, it's important to consider autoimmune encephalitis in any patient with unexplained neurological or psychiatric symptoms. Diagnosis involves a combination of clinical evaluation, brain imaging, and laboratory tests. A detailed neurological examination is essential to assess the patient's mental status, motor function, sensory function, and reflexes. MRI of the brain can help to identify areas of inflammation or structural abnormalities. However, in many cases, the MRI may be normal, particularly early in the disease course. Lumbar puncture is critical. Cerebrospinal fluid analysis can reveal inflammation, such as elevated white blood cell count or protein levels. Importantly, specific autoantibody testing on the CSF and serum is crucial to identify the target of the autoimmune attack. This testing is done at specialized laboratories and can take time to come back. Autoimmune encephalitis encompasses a spectrum of conditions, each linked to different autoantibodies. Anti-MDA receptor encephalitis is one of the most well-characterized and is associated with antibodies against the MDA receptor, a crucial protein for learning and memory. Other types include LGI1 encephalitis, associated with antibodies against the LGI1 protein, which affects seizures and cognitive function. CHASPR2 encephalitis, linked to antibodies against the CHESPR protein, often causing Morvan syndrome with neurological and autonomic symptoms. And GABA receptor encephalitis, associated with antibodies against the GABAB receptor, which can cause seizures and encephalopathy. Recognizing these different subtypes is essential for guiding treatment strategies. The cornerstone of treatment is immunosuppression, aiming to dampen down the overactive immune response. High-dose corticosteroids are often the first line of treatment, followed by intravenous immunoglobulin (IVIG) or plasma exchange. In more severe or refractory cases, stronger immunosuppressants like rituximab or cyclophosphamide may be used. If an underlying cancer such as a teratoma is identified, surgical removal is crucial. Symptomatic treatment is also important to manage seizures, psychiatric symptoms, and other neurological complications. Close monitoring for side effects of immunosuppressive medications is essential. Unfortunately, there aren't definitive ways to prevent autoimmune encephalitis, given that the exact triggers are often unknown. Research is ongoing to better understand the factors that contribute to the development of these autoimmune responses. However, avoiding unnecessary exposure to infections and prompt treatment of infections when they occur might be beneficial in some cases. For individuals with a known history of autoimmune disease, close monitoring for neurological symptoms is important. The prognosis for autoimmune encephalitis varies depending on the specific type, the severity of the condition, and the timeliness of diagnosis and treatment. Early diagnosis and aggressive immunosuppressive therapy improve the chances of a good outcome. Some individuals may make a full recovery, while others may have residual neurological deficits. Relapses can occur, requiring ongoing management. Recent research is focusing on identifying new autoantibodies, developing more targeted therapies, and understanding the long-term cognitive and psychiatric outcomes of patients with autoimmune encephalitis. The field is rapidly evolving, offering hope for improved diagnosis and treatment in the future.